Scarlet fever will make a comeback, according to University of Queensland scientists. In the 19th century, thousands of people all over the globe died from scarlet fever. The carriers are usually children aged between 5 and 15 years old. They are also the ones who suffer most from this bacterial infection. Hence, it was once a serious childhood illness. Scarlet fever also manifests in some individuals who have strep throat. The disease appeared to gradually die out in the 20th century due to antibiotics. Unfortunately, scarlet fever will re-emerge, according to scientists from the University of Queensland in Australia. They studied small outbreaks of scarlet fever in Asia and the UK in 2011. Streptococcus pyogenes is a bacteria that causes scarlet fever. It became stronger after being infected by another virus. The researchers also examined a group of A strep genes. Scarlet fever is a member of this family, revealing that the bacteria has found a new way of infecting a host. This process is known as horizontal gene transfer. Horizontal gene transfer occurs when a gene that has evolved in the viral genome is cloned into the new host's DNA. For the scientists, the said process makes the bacteria more challenging to treat using conventional antibiotics. This is because the bacteria is embedded in the system. UQ bioscientist Mark Walker said that the acquired toxins enable Streptococcus pyogenes to invade its host, potentially outcompeting other strains. The COVID-19 pandemic has made it easier to contain the scarlet fever outbreak. According to the scientists, this is a blessing in disguise. The pandemic pushed governments to implement measures to curb the virus spread. However, once these measures are relaxed, scarlet fever would likely return to infect people. A vaccine against scarlet fever will play a critical role in eliminating this disease. Common symptoms of scarlet fever are red rashes that look similar to a sunburn, red lines around certain parts of the body such as the elbows and the knees, red and bumpy tongue, flushed face, a fever of 38.3 Celsius or higher, often accompanied by chills, headache, nausea or vomiting, and enlarged tender lymph nodes. Since there is no vaccine, there are safety measures that everyone can follow to prevent scarlet fever. This includes thorough and frequent hand washing and covering your mouth and nose. It is also recommended not to share eating utensils or food with other people.